Welcome to Canada House Clinics. My name is Christina Rousseau, and I'm a cannabinoid therapy educator and licensed practical nurse. Today, we'll talk about if cannabis is right for you, Cannabis 101, and also the next steps after this video. Is medical cannabis right for you? Medical cannabis has shown medical benefits for hundreds of years. Research papers and patient testimonials have suggested that medical cannabis has helped with multiple conditions such as PTSD, chronic pain, insomnia, depression, fibromyalgia, stress, and many more. So, how does medical cannabis work with your brain and body? Similar to the respiratory system and the circulatory system, humans have what's called the endocannabinoid system, and the purpose of this system is to provide homeostasis or balance in the human body. The endocannabinoid system has two different receptors found throughout our body. We have the CB1 receptor, which is located in our nervous system, and a CB2 receptor, which is located in our immune system. The body creates molecules called endocannabinoids, which bind to these receptors to achieve different effects in the body, such as lowering stress, decreasing pain sensation, and improving mood. Some of the medicinal components of cannabis can mimic the body's own endocannabinoids, therefore interacting with CB1 or CB2 to achieve homeostasis. We call these components phytocannabinoids. The cannabis plant creates over 100 different cannabinoids. The two most widely researched are THC and CBD. THC can cause cognitive impairment, better known as the head high effect. This cannabinoid has been effective in treating pain, insomnia, depression, stress, anger, PTSD, neuropathic pain, and many more. CBD does not cause cognitive impairment. It has been shown to help with pain, inflammation, anxiety, and neurological disorders. Cannabis is divided by three different strains. We have indica, sativa, and hybrid. Indica is mostly used during the evening and nighttime. It creates more of a calming, relaxing, and sedating effect. This strain has been effective to help with pain, insomnia, depression, anxiety, and muscle spasms. Sativa is mostly used during the daytime and provides more of an energizing, uplifting effect. Sativa can help with depression and focus. Hybrids are a mixture of both indica and sativa strains. The types of hybrids are indica dominant hybrid, sativa dominant hybrid, and balanced hybrid. You can expect to experience more of the effect associated with the dominant strain. So, why do different cannabis plants have a distinct smell? Cannabis plants have a distinct smell thanks to its natural essential oils called terpenes. Terpenes are not only responsible for the smell and the taste of cannabis, but it's also responsible for the mind and body effect that cannabis creates. Some cannabis strains can smell like citrus or lavender, while others can smell spicy or even like pine trees. Terpenes can also increase or decrease the effect of cannabinoids. This is known as the entourage effect. The most prevalent terpenes are linalool, limonene, myrcene, carophyllene, and pinene. Linalool, also found in lavender, helps with insomnia, stress, anxiety, depression, and pain. Limonene, found in citrus, lemon, and orange, helps with anxiety, depression, and gastric reflux. Myrcene, found in mangoes, helps with inflammation and insomnia. Carophyllene, found in pepper and basil, helps with insomnia, inflammation, muscle spasms, and pain. Pinene, found in pine needles and sage, helps with inflammation. Recent research demonstrates that the product chemical profile is far more important than the strain of plant from which it originated. For example, the terpene myrcene is what's responsible for how sedative or energizing a strain is, not whether it's an indica or sativa. As you may know, there's multiple ways to consume cannabis. There's smoking, vaping, oils, edibles, and topicals. Smoking is the most traditional form to consume cannabis, and it comes in various forms, like a water bong, a pipe, a joint, etc. When smoking cannabis, the effect is felt almost immediately and lasts up to 90 minutes to 4 hours. Smoking is the least recommended method in consuming cannabis because it contains some of the same volatile chemicals found in cigarette smoke. Also, it can burn up to 80% of the plant's medicinal properties. The better alternative to smoking is to vaporize or vape your cannabis products using a vaporizer. Vaporizers heat the cannabis just below the point of combustion. The essential oils and cannabinoids of the plant are boiled off into vapor that is then inhaled. This is less irritating on the throat and on the lungs. This provides an almost equal response time as to smoking, and the effect can last up to 90 minutes to 4 hours. Oils are usually administered orally and are highly concentrated. We recommend to start low and go slow. The effect can last up to 6 to 8 hours. Cannabis edibles are made using infused butter or cooking oil. The effect can last up to 8 hours. Edibles create more of a relaxing body effect compared to the traditional cerebral effects associated with cannabis. Topicals are applied directly to the skin and do not cause cognitive impairment. So similar to other prescribed medications, medical cannabis is not suitable for everyone. We exercise special precautions with patients who have mental, heart, or respiratory conditions, or who are pregnant or planning to conceive. So pharmaceuticals that may exaggerate the effect of medical cannabis include, but are not limited to, antidepressants, benzodiazepines, and narcotics. Pharmaceuticals that may interfere with absorption are theophylline, central nervous system depressants, clobazam, warfarin, and amphetamine. CBD can increase or decrease the plasma levels in certain medications. It has been shown to also interact with anti-anxiety medications, antibiotics, SSRIs, and other medications. Alcohol consumption can also cause unwanted effects when paired with medical cannabis. Possible side effects while using medical cannabis may include dizziness, red or dry eyes, change in heart rate or blood pressure, and lowered blood glucose levels. So speak with your cannabinoid therapy educator if you feel you may be experiencing side effects. It is illegal to operate a motor vehicle when cognitively impaired by cannabis. Cannabis must be safely stored out of the reach of children. Traveling with medical cannabis is legal within Canada if your medical cannabis is stored in its original packaging. Up to 1 month's supply may be kept on hand, up to a maximum of 150 grams. Following this video, you will meet with your cannabinoid therapy educator who will then create a personalized treatment plan based on your diagnosis and your symptoms. All of your cannabinoid treatment-specific questions will be addressed during the appointment. As well, we will create a medical intake for our prescriber to review. Your prescriber appointment will follow after completion of this appointment. If you're not already booked with our prescriber, you will be contacted with further information. Once you have completed your prescriber appointment, our medical team will send your medical document to your selected licensed producer. They will contact you by phone or email once your file has been processed and you are able to order. If you have not heard from your licensed producer within 5 to 7 business days, please contact your clinic for further assistance. So do not hesitate to reach out to your cannabinoid therapy educator for assistance in placing your orders, product availability, or shortages. Thank you for choosing Canada House Clinics. Remember, this video can be watched anytime on our website, canadahouseclinics.ca. Stay connected with us by following our social media channels.